There's a space for the conventional medicine, there's a space for functional, integrative medicine, diet. When we work together, we find that the quality of life and well-being of our clients and our patients is much better. So I think this conversation is a two-bit way because we need both sides of the sector. And that's why practicing integrative medicine works way much better because it's a combination of the two factors. If you've been hit, ukigongwa na motorbike, hata uweze tu mwarobaine na umevunjika mfupa, hiyo mfupa haitarudi kwenye, it's a symbiotic relationship. On the flip side, you're a non-diabetic, right? And you've been non-diabetic for a very long period of time. You need both spectrums. You need your diet, you need your nutrition, you need your lifestyle changes, and maybe you walked in and your sugars were, or maybe you walked in a coma already because of extremely high sugars, or they were extremely low, so you just ended up dipping. You need to go to a facility. It might take very long because your system and your body has already reprogrammed itself to function with the high levels of sugars. You get? So you walk into a facility and your sugars are unrecordable. They are too high. So what will they do? They'll give you an emergency to be able to lower your blood sugars. On the flip side, you could be at home and you got your sugars were checked, you were told they're extremely high, and then you went told them, no, me, I don't want to take medication. I want to try and see if this diet has worked. If diet will work. Who has advised you on the diet that you need to change so that it can be able to work? You get? Because you might be going back home and saying, so from today, I'm not going to eat any more ugali or rice. But you're not doing anything else. That sugar will remain spiked up there. And remember, as I said, your body has already reprogrammed itself to live with high sugars. So Dali, you're so insulin resistant, you will need assistance to be able to get out of that insulin resistance. And you will need to work a lot to be able to get out of that spectrum of insulin resistance. Evidence-based medicine, first of all. Whatever, even when you come from an integrative medicine practice, you're practicing things from an evidence-based approach. And especially when it comes to things like integrative and functional medicine, most of the times you find it's things that have been practiced in Europe, China, Japan, things that they've been doing for years and years. We've also been doing the same thing. It's just that the difference comes in from a research perspective, meaning we are not using our own population to research that oregano, to research that. I think hiyo mkijiti you mentioned, hiyo ni mkombero, if I'm not mistaken. To research that mkombero, to research that leaf, that herb, that root, that we're not using our own people to actually research that. You get? So there's already evidence-based information from a European perspective. So you find that these things actually do work, but I always say an evidence-based perspective because you've asked an important question. The side effects of conventional medication, you already know their side effects, right? Flip side, there are some actual medications or supplements or herbs that should only be used for a certain period of time, and then you stop because of the effect they can have if you use them for a prolonged period of time. Some vitamins can cause deficiencies of others if used for a prolonged period of time. Is it making sense? Yes. So you need to know. So that's why I said integrating the two concepts together is also something. And remember, even combining conventional medication with herbs and supplements can also cause an interaction. There's actually a platform that has drug interactions. Just the same way we have conventional medicine drug interactions, there is a platform for drug interactions between medication and herbs. So you're able to know mtu akimeza Panadol hafai maybe kumeza herb fulani. You get? There's a video I saw going around and it broke my heart because at some point I was like, people may just use this herb senselessly. Even as a person who prescribes a lot of diet and lifestyle changes using personalized supplementation, I try to figure out how we can be able to use food to be able to cater to your needs. Because you know what you're eating from the ground is what you'll be able to live with for the rest of your life. That is what is more sustainable. And even in a healthcare system where being able to afford your diabetes medication for a 1 month dose is a problem. It becomes something that we need to think about, because if I'm being unable to afford for this month, what about the next 3 months? What about 6 months, 1 year, 10, 15, 20 years, and I'm still on the same medication? Who is paying for it? Is it my insurance? Am I paying out of pocket? Are my relatives doing donations and recharges? What if we speak to our people about what are we growing, so that we can introduce those foods into our meals before we even get the conditions? Okay. Such that you either prevent the condition from happening, number one. If you already have a condition, e.g., you have diabetes, you prevent yourself from complicating because you're supplementing the dawas that you are prescribed with a proper, balanced, healthy, nutritious diet. At K's Wellness Center, we actually don't just tell you eat a balanced diet. Actually consider where you stay, your finances, what can you be able to afford, what is available, readily available to you. We usually have a conversation with you for about an hour, 45 minutes. We get to the point where we tell you this, if this is what is affordable to you, let's have this because it's nutritious to you. Is it because you're just eating poorly, you're skipping too many meals? Are you stressed out? Is there a condition that you have? So once you figure out what exactly is the root problem, then you deal with that root problem. So yes, food does work as medicine, because some of these foods and plants and crops are usually also used in the making of medication. Remember that. So food is also a very crucial, it's a very big factor in prevention and management of diseases. So you see, you avoid some things happening later in life. And the best part would be, you would find the burden, the prevalence, the incidences would go down, and our longevity would be, yes. So you'll be in your 80s and you're, when you're in your 80s, you hear you have diabetes, do you have this, do you have dialysis, I'm going to my doctor, I see so and so. It doesn't have to be. Because when you make those changes, now it becomes part of your lifestyle. Right. When you change them in your younger years, they're now things you end up practicing in your consecutive. You get. Thirdly, we also train our children, educate our children. I don't know if you saw that video. There's a very interesting video that I saw on TikTok, IG, of kids it was Chinese kids. They were being educated on the use of food as medication. I was shocked. Those guys look like they're in class 1, class 2. So you can imagine what that will do to that child as they continue growing up. And they were asking very pertinent questions. They're like, okay, so it means this food provides nutrients like an orange, for example. So it provides vitamin C. So if I eat the orange, it means my immune system will be boosted. Those are the kind of questions they were asking. So you see, those are things that have been ingrained from a young person, which means every time you think of flipping over to overeating processed foods, your brain is like, okay, I need to have some nutritious foods by my plate, right? So that's the other third factor. Doing some of these things from a young age. So you could also have been diagnosed with elevated sugars, but your sugars are doing at a level of, for example, 19, or they're below 20, they're at 10. So they're not extremely high that they're causing you issues. Now, two things stand. We sat down with you and we've told you, and food is the medicine, right? We've sat down with you and we've told you, you need to change your diet to this, your lifestyle has to change to this, and this is the other thing. So we've put for you a 10, 20 to-do list of the things that need to change. And then we are telling you in the next, be recording your sugars every single day. Because if we sit down with you as a patient and we have the agreement of, we are going to use diet, lifestyle, and maybe personalized supplementation to be able to help you improve your health. You now have to keep monitoring those levels. And maybe being me, I keep on looking for you every day, whether I look for you via phone call or via WhatsApp, because I know the impact of poorly regulated blood sugar, blood pressure, or a chronic disease, name it. It will have a complication of your kidney is malfunctioning, your liver is misbehaving, umeanza kuganda mikono, umepatwa na stroke, na nilikwambia enda nyumbani na pressure ya 200, hiyo nayo hapana, sure. There's some things, you assess the situation and we sit down and we talk about it. What I've come to realize is that if you sit down with your client and just sit and agree, na asione kama ni punishment, na up here, their psychology also gets to understand, okay, I am 22, my blood pressure is misbehaving. Na nilidhani, this is something that inapatikana kwa watu wako 67 years old, but okay, it has found me. So they need to accept that is happening. So we can also be able to help them change their behavior. One of the most difficult things to change is behavior change. Ati nimezoea kukaa njia fulani, alafu sijui unaniambia sijui It takes time, and we are usually understanding to our patients because we know even mimi ukianza kuniambia hapa ati kutoka leo lazima niwe nakula pandagu kila siku daily, for example. And maybe it's something that I'm not used to. So that's why we look at it holistically. Has your brain accepted it, or in your mental space, are you in a space to accept it? Will you be able to afford these things? What are the alternatives now? Look at it from communicable diseases. Because what you're speaking about mostly ni non-communicable disease, meaning a chronic disease or a disease yenye like nikikohoa sikupei, mimi niko nayo, you get. So kama uko na malaria or rather an infectious disease, so it's communicable or it's infectious. Uko na malaria, uko na TB, uko na pneumonia, and then you decided you're going through a severe infection and you decided you're going to chemsha something and drink it. You need to be very careful, because from a conventional perspective, dawa zimefanyiwa research alafu zimewekwa into a graded dose. So if you have a mild infection, a moderate infection, a severe infection, this is the quantity of drug that you should be taking for your kgs. So is it 1 gram, 2 grams, 3 grams, or whatever? Should it be oral medication as you asked, or should it be IV medication? You get? So there is an assessment that is usually done. Most of the times, maybe after hizo orals na IV is when you can now sit down and say, okay, now I need to boost my immune system because I've been getting sick of late too often. And that's where we come in and help you out. So how are we boosting your immune system? The diet comes in. When people are admitted in the ward, na amekuja juu ako na shida ya tumbo, gastritis, the reason they were admitted was probably because those gastritis or ulcers zilikuwa zina bleed. You get? So they were either vomiting blood, or their poo was black, so meaning there was blood somewhere. So they needed to be kept in a space where that bleeding is controlled. Otherwise, if you continue bleeding like that, what will happen? Anemia, amongst other problems. So there's a space for the conventional medicine, there's a space for functional, integrative medicine, diet. When we work together, we find that the quality of life and well-being of our clients and our patients is much better.
Because the main aim, all we want as doctors is for the best patient outcomes, right? And to lower all these prevalences and chronic disease outcomes. And the best part would be we'd find the burden, the prevalence, the incidences would go down, and our longevity would be, yes. I say functional medicine is very affordable because we are looking at things that surround you or affect you more. The role of functional medicine is quite high because it digs deeper as to identifying why exactly do you have that chronic disease other than genetics, because genetics is a very small percentage. The fact that it gets to the root cause and then now addresses that root cause is what makes such an important aspect, bringing it into the chronic disease world.